Hi, my name's Caroline. I'm an advanced recovery practitioner working at Turning Point Inspiring Futures in Wakefield. I work with young people under the age of 25 to make changes to their substance use. And I'm here today to talk to you about what ketamine is and the impact we're seeing on both young people and those over the age of 25. So to start with, what is ketamine? It first sort of became to be as an anaesthetic to replace PCP. PCP was quite unsuitable because it produced quite severe hallucinogenic effects and it could also cause breathing difficulties. So they found that ketamine was a safer anaesthetic to use at this period of time. Ketamine is still used in both veterinary and human medicine and is used as a strong anaesthetic regularly. When it was first created, it was often used in the Vietnam War for pain and for as a way of leaving reality. And ketamine at certain doses doesn't have any kind of effect on the breathing. So it was, again, just a safer anaesthetic to use at this time. I'm sure we've all heard lots of different nicknames for ketamine. So on here we've got K, Ket, Special K and Super K. If you can think of some more, please share them with those around you so that we're all able to hear what they might be, because it changes every day. I've heard other ones like Kezel and Kenny, and it's just important to be aware of what those nicknames are so that when we hear young people or older, those over 25 talking about ketamine and ketamine use, we know what it is that they're actually talking about. It's used in different ways. So it's usually seen as a powder that would be snorted, but it can be wrapped and swallowed, which can also be called bombing it, or it can be injected as a liquid. And the kind of way it would make people feel is quite euphoric, calm, uncoordinated, confused, numb, or nauseous. The main point of ketamine is that it is a dissociative anaesthetic. So it means that people feel quite detached and remote from their immediate environment when they are using it. But it is a very dose-specific substance. So the effects from what you may call a small bump may be very different from what a large 200 milligram or more dose may be. So the duration of using ketamine, it would usually start as an onset of about 5 to 10 minutes, come up of 10 to 15 minutes, then it would peak at around 30 to 60 minutes. And so overall, it will last for about 1 hour to an hour and a half. But the after effects can then last for another 1 or 2 hours. And like I said, because it is quite dose specific, each dose does have a different kind of impact on the person that is using it. So a low dose would be around 20 to 80 milligrams. This would mean that a person experienced quite an alcohol-like state, so that can heighten their mood, heighten their energy, a feeling of body lightness, which encourages a desire to move, and lots of feelings of calmness and serenity. So then we've got the moderate dose, which is sort of 80 to 150 milligrams. This would be where somebody may start to experience physical disorientation, euphoria, time distortion, maybe feelings of separation from the body, and something that we would call a body high, which makes the body feel quite tingly. And then a high dose is sort of looking at 150 milligrams to 300 milligrams or more. And this can cause the experience of a K-hole, where it's like an out-of-body experience where the user becomes unresponsive to external stimuli and can experience hallucinations. At this point as well, it can cause the person using to feel quite sick or to actually throw up. And this would be very dangerous at high doses, because if they are unconscious or disorientated, there is the risk of that person choking on their vomit. So we've talked about how it can make you feel. So what it can do, the physical effects are sort of like a sedation. So it can cause a moderate sedating effect, which would discourage any physical activity. And at high doses, it can cause the person that is using to be quite immobile. It can cause some spontaneous bodily sensations. It's like we said, the body high, which is like a sharp, pleasurable, tingling sensation, and that can be felt in hands, feet, and the head. And then the bodily lightness. So it may feel like the body is floating or weightless. And at low doses, this effect can be quite stimulating. So promoting physical activity, making the body feel effortless to move. And this would be why we see this ketamine used in sort of the party scene. There are cognitive effects as well. It can suppress anxiety. It can cause a cognitive euphoria. But because the euphoric effects are quite short-lived, it can be lead to kind of like compulsive redosing, and find that people keep using to keep getting that feeling. It can also cause kidney-related problems and bladder damage, which we will look at a little bit further along in this session. So what does it look like? So it's usually seen as a crystallized powder. So this, as you can see in the middle picture here, but it can also be a liquid which is injected. We usually see people using the crystallized substance, which will be crushed up to be more powdery, as this is kind of like less damaging to the inside of the nose. And it's really important for us when we're working with any substance user, anybody using ketamine, to talk to them about how to keep safe when they're using. We know it's quite hard for people to just stop using substances straight away. So sometimes the safest thing to do is support them to reduce their substance use and support them to do it in a safe way. So as I already said, it's usually found as a white shard-like crystal, and it's important to crush that ketamine into a fine powder to avoid any damage to the sensitive membranes inside the nose. It's important for the nose to be rinsed after each session to remove any leftover ketamine residue, and to try and alternate nostrils when sniffing as well, just so that not one side of the nose is getting damaged over and over and over. There are oils like vitamin E oil, which can be used inside the nose after it's been cleaned, just to help with any cell regeneration and just to keep that area of the nose moisturized. It's really important with any substances to avoid any kind of sharing of drug paraphernalia, so to avoid sharing any snorting equipment, because you can, if you are sharing any kind of drug paraphernalia, you're at risk of bloodborne viruses such as Hep C, Hep B and HIV, and also just risks of common germs and bugs. When it comes to using ketamine, it's really important to stay away from heights due to the risk of falling. It can make a person quite unsteady on their feet. And also important to avoid going swimming or getting in a bath, because again, if that person was to become unconscious, there is a high risk of drowning. Also, when using ketamine, as we've said, it is a anesthetic, so it can mean that a person doesn't feel any pain, and may forget to get any injuries looked at by a medical professional. So even if that person can't feel the pain, it's really important for them to get any medical support for any injuries. There have been cases where people have been hit by a car and not felt the injury at the time, ran home, and when they've woke up the next morning, found they're in a lot more pain and they've caused further damage to that area of the body that they damaged in the car accident. Also really important to stay hydrated. Ketamine does affect the bladder, and if the bladder is not being used properly and it's not able to fill up with urine as it should, it can stay small, and that's when we start to see bladder problems in people using ketamine. It's also really important to avoid mixing any substances, whether it's ketamine and cocaine, whether it's alcohol and ketamine, whether it's cocaine and cannabis. It can make the substances interact with each other, and this could lead to respiratory depression and potentially death. Always really important, again, with any substance use to go low and slow with use. We don't know how strong that substance could be. The ketamine might be stronger than somebody is expecting, stronger than what they're used to. They might have had a couple of days without and their tolerance to the ketamine has dropped, or the ketamine might have been mixed with something that they're not expecting to be in there. So using small amounts at a time, and just taking it slow means that that person isn't as at risk of overdosing. Also, always important to try and stay with friends or trusted people, not using by yourself, because if you were to use on your own and something is to go wrong, nobody's able to call an ambulance for you. And as we've already said, because it can interfere with coordination, it can cause people to bump into objects, fall over, and not feel that pain. So mixing ketamine with stimulants such as cocaine can increase the heart rate and blood pressure, and it could lead to heart problems or unpredictable outcomes. And mixing ketamine with substances like alcohol or GHB can increase the risk of that person becoming unconscious and could increase the risk of choking on vomit or food. Mixing ketamine with a substance such as an opiate has a synergistic effect, and that can increase the strength of both substances, which both then increase inhibition in the nervous system, and it can risk memory loss, falling unconscious, respiratory depression, and again choking. And similar with substances such as benzodiazepines. So both ketamine and benzodiazepines have an inhibitory effect on the nervous system. Therefore, combining them increases the risk of memory loss, falling unconscious, respiratory depression, and aspiration. Mixing ketamine with other substances that produce a psychedelic effect, such as LSD or MDMA, it can heighten that psychedelic experience in a way that might feel quite overwhelming and difficult for the person to manage. So when it comes to tolerance levels and patterns of use, people taking ketamine on a regular basis may find that they have developed a tolerance to that substance, meaning that they need to take more and more ketamine to get the same effects that they're looking for. But if you do start to take ketamine on a regular basis, there is a risk of developing a dependency on it. And becoming dependent on something means that you do feel the need to use the substance regularly, feel you need it to get through your day. Dependency can lead to more ketamine-related health issues, and it can lead to debt. One of the reasons we see a lot of ketamine use is that it is one of the cheaper substances for young people to buy. However, using it on a regular basis would still start to build up the amount of money that that person is spending. They might be laying it on with their drug dealer and getting themselves into a lot of debt and putting themselves at risk from other people around them. And then as well, the more ketamine that the person might be using, it might start to affect their relationships, their work, studying. So as we have already said earlier on, it's important to go low and slow with any ketamine use, especially after a period of abstinence. Important to not just assume that you'd be okay by using the same amount as you would have done previously, just because that can result in overdoses. When we're working with users of ketamine, we suggest trying to track their use, using tracking sheets or using the phones or diaries to track use can help somebody to see how much they're using, try and establish whether there is a pattern in their ketamine use and whether there is any triggers for their use. And it can really help with them making any reductions to their use. There can be some kinds of withdrawal symptoms from becoming dependent on ketamine and going without, causing people to feel quite anxious or low in their mood. There are no medications to treat any kind of ketamine dependency. It is really important for people to work alongside their turning point or substance use workers, work alongside their medical professionals and get support from family, friends, and find a support network to help them make changes. So just a couple of the other effects of ketamine on the body. So it can damage membranes in the nose. We've talked about the paralysis that can occur from being in a K-hole, the risks of being unbalanced, possibly falling over, blurry vision, feeling quite lightheaded, hallucinations, and of course the ketamine bladder and the damage that that can cause. So K-cramps. K-cramps or ket cramps refers to the abdominal pain that people can experience when their urinary tract becomes damaged due to ketamine use. So there are different stages to ketamine bladder syndrome, and that can also be called ketamine-induced ulcerative cystitis. So the first stage of ketamine bladder syndrome causes the bladder to shrink and harden. So then the bladder is not able to hold as much urine. And you'll see that people using ketamine are having to urinate quite regularly. At stage 2, there is a toxic effect which causes the bladder lining to ulcerate, and this can cause blood being passed in the urine. At stage 3, users of ketamine might find that they're passing lumps of like jelly in their urine, and that is actually the bladder lining and tissue leaving the bladder, and that can cause severe pain. Often we see that people are having to have their bladders removed or reconstructed. They may have to have a stoma bag to drain the urine, or we're seeing that people are having to have nephrostomies, which are bags into their kidneys to help drain away any of the urine from the kidneys to give the bladder a little bit of a break. What kind of happens is if the bladder cannot hold the urine anymore because it's stayed too small, the urine is going back into the kidneys, and then the kidneys are having to hold the urine, and this can cause the kidneys to swell, and then the kidneys will start to fail because they're not built to hold the urine in that way. So that can cause kidney damage and potentially sepsis as well. And we have seen people where they're having multi-organ failure from the damage that they've caused to their bladder from their ketamine use. It's really important for people using ketamine to speak to the GP about any pain that they're having. And the most important advice is for them to try and stop their ketamine use as soon as they start to notice any bladder related symptoms. We do understand that it's not as simple as just stopping use. And that's why, again, we're here to support with that and try and work towards making reductions and using in a safe way. Hot showers and hot baths and hot water bottles can really help with any of the ketamine bladder symptoms and the ketamine cramps. It's really important to be aware that using a hot water bottle whilst under the influence of ketamine would be quite dangerous. There are rechargeable sort of heat pads that you can get instead of filling up a kettle and boiling that water and risking scalding yourself. And also it's really important for people to be aware of having a bit of a space between the hot water bottle or the wheat bag or whatever it might be, between that and their skin, so that they're not constantly burning their skin on their stomach. And again, being really careful to not have that hot water around their skin when they are under the influence, as it could burst, cause burns to their skin. And then again, that if they don't feel that burning, they don't feel that injury, they might not get it looked at in time, and that could lead to other infections. It has been found that in out of about 2 of 3 cases, people using ketamine have found that their symptoms have improved when they stop using ketamine. But in 1 of 3 cases, the symptoms have stayed the same even when they've stopped using ketamine. So when they do continue to use ketamine and they're having bladder symptoms and bladder problems, it becomes really difficult to get those symptoms under control and that pain under control. So there's lots of risk-taking behaviours that we may see that come with ketamine use, may come with all different kinds of substance use. So obviously we've got a list of them here. unprotected sex. That could also lead to any kind of sexually transmitted infections or diseases. Getting into fights, and again, any fights whilst under the influence, they might not get their injuries looked at in time. Committing crimes, often we'll find that people are stealing to try and get enough money to pay off their debts or to pay for ketamine. And then obviously committing crimes does lead to getting the risk of a criminal record or being arrested. Might find that people start to miss appointments or skip school so that they're not getting the support from their GP or support from substance use services to make changes. And then they might find that they're getting excluded from school, not getting that education, not being able to go to college, not being able to go to work. Obviously, we've talked a lot about how it affects the health, and if the person has found that they've got ketamine bladder symptoms and they're having to use the toilet every 5-10 minutes, it can be really difficult to go to school or hold down a job. There are the risks of domestic abuse, child criminal exploitation, child sexual exploitation. It could cause arguments with family and friends, getting into debt or owing drug dealers, even becoming homeless, county lines, injuries, and even being a victim of a crime. So the law around ketamine at the moment, ketamine is a Class B drug. So possession of a Class B drug can land you up to 5 years in prison and or an unlimited fine. And dealing or supplying ketamine can land you up to 14 years in prison. So as we have said quite a few times, there are a lot of risks to ketamine use. Ketamine bought on the street from drug dealers is usually sold as a white or beige crystallized powder. However, it can sometimes be cut with other powders to add weight, and that then improves the dealer's profits. And it's impossible to tell whether the ketamine you buy has been cut with other substances just by looking at it. So it's really important to be aware of the risks of overdose when using illicit substances such as ketamine. The risk of overdose is always going to be higher if it has been cut with something that you're not aware of being in there. And these unknown substances can sometimes be synthetic opioids such as nitazenes. So we do have some slides coming up about naloxone and Nixoid, which we do provide to all of our service users. And these are medications that can help in the event of an opiate-based overdose. But it's important to remember that naloxone or Nixoid do only work on any opiate-based overdoses. So they wouldn't work on a ketamine-specific overdose, but it can be used to kind of rule out the possibility of an opiate being cut into the ketamine. Using a naloxone or Nixoid in the event of a ketamine overdose would not cause any harm to that person. When it comes to the risks of overdosing on ketamine, snorting or injecting ketamine means that the ketamine can get into the bloodstream quite quickly. So being careful with dosages is really important. And the different signs of a ketamine overdose are things like chest pain, extreme confusion, fluid or other objects in the airways, high blood pressure, hallucinations, loss of consciousness, nausea, paralysis, or seizures. So on my next slide, we've got a few true or false questions around ketamine. So I'm going to go through them before I click onto the next slide, and then I will show you the answers. So think to yourself, true or false, ketamine is a Class B drug. And then we've got true or false, ketamine can cause you to hallucinate. True or false, ketamine is an anesthetic. True or false, ketamine has no long-lasting side effects. True or false, you cannot overdose on ketamine. And then true or false, the effects of ketamine can last from 20 minutes to a couple of hours. And so if you said true for the first three, you would be right. If you said false for the 4th and 5th, you would be right. And then the last one is a bit of a trick question, so it is true, but it can vary from person to person due to differences such as your size, how much you've taken, and what other drugs you might have taken. So, as I already mentioned, naloxone and Nixoid is available from our service at Turning Point as either an injection for our over 18s or a nasal spray for our under 18s. We issue a naloxone or Nixoid to everybody that we work with for emergency use in any opiate-related overdose situation. And we do also provide and offer safe storage boxes and education on how to store medication safely away from others. So here are 5 signs of an opiate overdose. So they may be unresponsive, the breathing may have shallowed or stopped, they may look pale or ashen in their skin, they may be snoring or have quite a rattling breath, and they may have blue or grey lips or fingernails. So in an emergency, it's always important to just call 999. If it is safe to do so, approach the unconscious person. Try and shout for help if there's people around that can support you. If it's safe to do so, check that they're breathing and put them into the recovery position. And again, administer CPR if not breathing. Try and stay with the person until the ambulance arrives, and always make sure the ambulance crew are aware of what substance they've taken if you are able to tell them. Just for example, if it's a ketamine overdose and the paramedics are not aware that they've used ketamine, depending if there were some injuries or something like that, if they were to then also need to administer medical ketamine for some reason, it's not going to work, or it's going to cause more risk to that person. And then sometimes people won't call an ambulance because they think that the police might come as well. But there are policies in place to make sure that the police don't always attend any suspected overdoses. And it's just always important to call 999 to get support for somebody, because any overdose is a risk of death to that person. So here at Turning Point, we are a free and confidential service. We're happy to have informal conversations with young people, family members and professionals. So please contact us just for any advice, any support. We'd want to help everybody as much as we possibly can. So you can refer over the phone by calling the number on screen and selecting option 2. You can also refer via email, or you can refer on the website, and anybody can refer somebody under the age of 25. All referrals can be done by the substance user themselves. Referrals can be done by any professionals, family members, teachers, social workers, doctors. Anybody can refer. Obviously, we do need you to get consent from the young person, but we'll always try and work alongside you to get that young person to engage with service so that we can get them the support they need and prevent any further risks to their health or their future. So thank you so much for listening to me. We do have a base in the Wakefield City Centre at Radcliffe House. Our Inspiring Futures under 25s team is an outreach service, so preferably we would meet anybody out and about in a setting that they're most comfortable with. We'll see young people in school, in college. We can meet in family hubs. We do lots of home visits, and we'll just do everything we can to support anybody using any substances, including ketamine, as much as we possibly can. Thank you.
Please refer to these next 2 slides if you are aged 25 and over and would like support with your drug or alcohol use.